Hello everyone, welcome back to the channel. I'm Annie and today we are continuing our journey through the skeletal system. Now let's move to the neurocranium, the part of the skull that protects the brain. I'm going to use Complete Anatomy, a 3D platform by Elsevier. As a definition, the neurocranium is the portion of the skull that encloses and safeguards the brain. It forms the cranial vault and the cranial base, separating and protecting the brain from external forces. And we should not forget and mix that the difference from the viscerocranium, which creates facial skeleton. Now, let's discuss each bone separately. So, here is the first bone we call the frontal bone. We know that frontal means the front part, and basically it creates the forehead. And we also know that fore means front and head is head. Anyways, that's an anterior view, a superior view, inferior view, left lateral, and here you have the posterior view, aka we can also say that internal view. So that's a frontal bone. The next bone I want to show you is the sphenoid bone, which you can see how the frontal bone and the sphenoid create the sutures, unmovable joints, and this is from the posterior superior view, right lateral view, and inferior view. As you can see, between the frontal bone and the sphenoid bone, there is a triangular shape, and here we have another neurocranial bone, which we call ethmoid bone. Interesting fact is that the ethmoid bone actually creates the surface for the meninges to get attached with this protrusion, as well as if we look at the ethmoid bone from the anterior view, we are going to see that it creates concave for the nasal cavity, which increases the surface area for mucosa. And the last single bone is called occipital bone. That's a superior view, which is directly connected to the sphenoid bone, which is directly connected to frontal and ethmoid bones. So this is a superior view, left lateral view, and let's see from the inferior view. Here you have 4 single unpaired cranial bones: frontal, ethmoid, sphenoid, and occipital bones. Now let's move to the paired bones. Again, we are observing this model from the left lateral view, and we can see between sphenoid and occipital bone we have a bone that we call temporal bone, which is presented on both sides, on right side and the left side. Here you have the right temporal bone, and the anatomy is identical. If we look from the inferior view, we can see the occipital bone. What is this? Left temporal, right temporal, and here you have the sphenoid bone and occipital bone. Anyways, temporal bones. Here you have them. This is how they create the base or the shape of a structure that can house the brain inside. And last 2 paired bones, which we call parietal bones. This is left lateral view, frontal, sphenoid, temporal, occipital, and parietal. Let me show you from the superior view: frontal bone, occipital bone, and 2 parietal bones on the left and on the right side as well. Here you have. Now let's discuss the functions of the neurocranium. The first one is that neurocranium encloses and protects the brain inside, obviously. Here you have that first function. I'm very sure you know that the brain is fixed inside the skull through the meninges, and we have different layers of those, but anyways, the outermost the toughest most layer of the meninges, which is called dura mater, is attached to parts of the bones of this neurocranium in order to fix the brain and not allow the brain to move very fast and cause the concussion. One of the bones that I can show you is these ethmoid bones. Very easily isolate these meninges as well as the ethmoid bone. Is that if you remember, I showed you the protrusion on the ethmoid bone, which helps the meninges. Well, don't forget the meninges are all around the brain as well as the spinal cord too. Additionally, neurocranium contains foramina or canals that allow cranial nerves or the blood vessels to pass through. And it also supports our sense organs like the eyes and ears. Do you recognize all these tiny bones, ossicles? Here you have them. Now let's talk about the divisions of the neurocranium, which is divided into two main parts, the calvaria or the skull, which includes the top part of the frontal bone, parietal bone, and some top part of the occipital bone. Basically, they create together the roof of the neurocranium. And another division of the neurocranium, which we call the cranial base, which is created by ethmoid, sphenoid, temporal, and lower part of the occipital bone. Very much logical why we call that the base of the neurocranium. Now let's talk about the sutures of the neurocranium. There are multiple sutures, but I want to discuss four major ones. Let's talk about the first one, coronal suture. Corona means the crown. It's a space or the place for the crown, so that's why we call that the crown suture or the coronal suture. Coronal suture is between the frontal bone and two parietal bones. Now let's talk about the sagittal suture, which is in between two parietal bones. Okay, and that do not share this suture with other third bone. And the third neurocranial suture is called the lambdoid suture, and it is shared by three neurocranial bones, left parietal, right parietal, and occipital bone. We call this lambdoid suture because it looks like a Greek letter lambda. And the fourth suture is called squamous suture. And this squamous suture is between the temporal bone and parietal bones on each side, obviously. So we are going to have two squamous sutures on the right and on the left side. But interestingly, why it is called squamous suture? When we isolate this temporal bone, I will show you very soon in the next videos that this part is flat part, and actually squamous means flat, so that's why we call this squamous suture. It's because it is created by the flat part or the squamous part of the temporal bone. Okay, now let's talk about internal cranial fossa, which is inside the cranial base. There are three distinct depressions called cranial fossa. For that, I need to remove the two parietal bones, and here you have three major depressions. This is called the anterior cranial fossa, which holds the frontal lobes of the brain, the middle cranial fossa, which houses temporal lobes and pituitary gland, and we also have the posterior cranial fossa, which contains the cerebellum and brain stem. Now, I want to talk about 4 or 5 major foramina of the cranial base, which allow nerves and blood vessels to enter and exit the skull. Let's begin with the foramen magnum. Now, this is inferior view. Occipital bone has a quite large foramen we call the foramen magnum, through which for the spinal cords are passing through. Let me show you that. Okay, here you have the brainstem and the spinal cord that continues, descends, or you can also say goes upwards towards the skull through the foramen magnum, which belongs to the occipital bone. Now, have you ever heard about the jugular foramen? Actually, we call it jugular foramen because two internal jugular veins, and because they are quite large and quite important drainage system for the sinuses in the brain, the hole or the foramen that they exit, these two veins through the skull, we call that jugular foramen. And jugular foramen is created by two bones. One is, let me give you a proof, the temporal bone, and the second one is the occipital bone. When I isolate these two bones, you're going to see the jugular foramen here. Here you have that isolated structures, the sinuses, and the jugular foramen. Except internal jugular veins, through the jugular foramen exit three pairs of cranial nerves. One is number 9, number 10, and number 11. I'm not going to show you and go through into details in this video, but in the future, obviously. Additionally, we also have the carotid canal through which internal carotid arteries pass through. Let me isolate bones, and these bones, I'm very sure you can recognize that's two temporal bones through which, through this canal, internal carotid arteries enter the brain or the neurocranial vault and this space. Now, let me isolate the sphenoid bone as well so you can appreciate all the drama here that together these three bones create. The temporal bones, where is that? And sphenoid bone, here you have. Sphenoid bone has two canals, which we call optic canals. Actually, it is called canal because it's longer than foramen. Anyways, we called it optic canal because through it, optic nerves pass and create optic chiasm. Now, that brings us to the end of this introduction to the neurocranium, the bony vault that protects our most vital organ, the brain. In the next video, we will zoom in and take a closer look at the frontal bone, its parts, landmarks, sutures, and clinical relevance, all in beautiful 3D anatomy by Elsevier. So if you found this helpful, don't forget to like the video, subscribe to the channel, and turn on the notification bell so you won't miss the next anatomy session. And if you have any questions or suggestions, feel free to leave a comment below. I'd love to hear from you. Thanks for watching, and I'll see you in the next one.